Hello guys. So now we are at the last topic of general topics, that is preventive and social medicine. Okay. So this two, just like FMT, please watch it like a movie. So you guys would have known everything. Just a quick revision of it. Okay. So starting. So what is epidemiology? So it is nothing but research and study of the population. Okay. So epidemiology is the research and study of population. There are two things that I want you guys to remember with respect to epidemiology is triad of epidemiology and triangle of epidemiology. Triad is host, agent and environment, whereas the triangle is host, agent, environment plus the time. Okay, so if the time is there, if time is in the middle, so it is going to be a triangle. Okay, so triad plus time is known as the triangle of epidemiology. The tools that are required for epidemiological study is rate, ratio and proportion. See, all the maternal mortality ratio, rates and all these things, right? So this is what is the tool that is required for to study an epidemiology. Okay, so that's it. Then moving on to the types of epidemiological studies. Okay, there are two main types of epidemiological studies. One is non-experimental, that is observational, whereas other one is experimental. Okay, so we do something, we do some intervention and then we study, that is experimental, whereas we are just observing, that is non-experimental. There are two kinds of observational or a non-experimental studies, that is studying the population and studying the individual. Okay, so in population studies, that is descriptive and analytical. In individual also it is the same, descriptive and analytical. Okay, so coming to experimental study, it is going to be a randomized control trial and non-randomized control trial. We'll come back to that later. Okay, so now, so observational studies, it was population studies and individual studies. In population study, it was descriptive analytical. In individual also the same, descriptive and analytical. So let us see one by one. So descriptive is doing a health survey with respect to population. In a population, if we are doing a descriptive study, it is going to be health survey, whereas analytical will be ecological studies. Okay, so this is the difference with respect to descriptive and analytical studies. And now with respect to the individual discussion of epidemiology, the non-experimental type, it is also, again I told you, right, descriptive and analytical. In descriptive, it is going to be case series. Okay, then coming to analytical, it is going to be cross-sectional study, case control study and cohort. Okay, so this is the classification and that is how we come up to a cross-sectional case control and cohort. Okay, so finally you guys understood, right? So let us now look at each things and let us be clear with the case that they are going to give in the question. Okay, so starting with observational studies, so we'll start with descriptive, then we'll go on to analytical. Okay, so observational study, descriptive. So if it is a case series, it's gonna come up with the time, place and the person. Okay, so remember that. So with respect place and person, not much of importance. Please note that it is the time, cases that they are giving in the question, in the papers. Okay, so with respect to time, so please remember there are short term, periodic and long term. Okay, so these are the descriptive graphs that they'll give. So SCPs meaning single exposure. Okay, so SCPs is nothing but single exposure. Then MEPs is multiple exposures are there. Then the other one is propagated. Okay, so please remember these things. So the graphs would look like this. Okay, single exposure meaning there is a single exposure before the pathology occurred. Okay, so for example, food poisoning in a marriage or in a function, so the food poisoning had happened and all of them had a single exposure, right? So that is how the pathology propagated. Then coming to multiple exposure, it is going to be contaminated water, for example cholera. It is not a single day or a single time that it occurred, right? So it is gonna be this day some people some of them got contracted with that, then second day, third day, in that way, right? So it is gonna be multiple exposure, whereas propagated, so it is gonna be SARS-CoV, COVID, it was propagated, right, from one place to other place. Like as the day went on, it propagated, right? So that is how you can remember the example of propagated descriptive study. Then now coming to the analytical study, our favorite and the examiner's favorite, that is case control and cohort study. Okay, so starting with case control, see, please remember, if the question contains cases, okay, if the question contains starts with case and then they are giving a exposure, then it is gonna be a case control study. So what we actually are doing is, so basically there are cases, okay. For example, some of the people have got hypertension, okay. So what they'll do is, they'll give in the question itself, there are two things, okay. One is case, all the people that have hypertension, and they are also picking the people who do not have hypertension, okay. So this is how they'll give it in the question, okay. That is where we are starting. Now we are trying to find out whether they were exposed to high salt intake or not, okay. So this is an example I'm telling. So this is how the question will be, okay. So whether the salt intake was there or not. So that is what we are trying to find out, whether the salt intake is what led to the disease, okay. So from case we are trying to go backwards, that is past, okay. So the people have already developed a disease, so that is case control. Whereas in cohort, it is gonna be that we are gonna do two things. One is we are checking the exposure or giving the exposure, and then we are experimenting by following up in the future, okay. So we are trying to following them up and try to find out whether they'll develop a disease, okay. Here in case control, the question will contain the person has already developed the disease, okay. So there is two things now that we are finding the association between the particular disease and the exposure, right? So it is the odds ratio that we will take, okay. Odds that the case was exposed and divided by odds that the control was exposed, okay. So not all the controls would have developed the disease, right? So this is how we will find the odds ratio. Odds ratio is this is what the table looks like. So case control will be above and exposure and unexposure will be on the lateral side. So exposed and developed a case, then it is going to be A. Then exposed and he is a control, meaning he has not developed a disease. Then unexposed case and unexposed control, okay. So this is how we divide, and the thing I want you guys to remember is AD by BC. AD by BC will give you the odds ratio, okay. The interpretation would be, if it is 1 odds ratio, if it comes to 1, then it is going to be no association. If it is less than 1, then it is going to be reduce the disease pathology. If it is more than 1, there is increased association with the disease, okay. So that is how we'll find out the odds ratio, okay. Then now this is the case control, right? So they'll give the case first, and then we'll try to associate whether the disease was caused by that particular exposure, okay. Now here in cohort study, there are two kinds, okay. One is prospective and another one is retrospective. In prospective study, what we do is we'll follow up, okay. We ourselves will follow up on the patient, whereas in retrospective, the data is already present, we need not follow up, okay. So I'll tell you with respect to retrospective follow up. We'll finish off the prospective first, okay. So what we are doing is, we'll expose the patient, or for example, the patient is already exposed, now we are trying to follow up, okay. So we'll follow them up into the future and see whether they developed a disease or not, okay. So this is the prospective cohort study, okay. So here is where the relative risk ratio comes in, okay. So here also we are trying to tell whether the association the exposure caused the disease or not, okay. So in the case control also it was the same thing, but we followed up in cohort, whereas the data was already present with respect to case control, okay. Then the relative risk ratio is index incidence among the exposed by incidence among the unexposed. Okay, so did they develop the disease based on exposure or not because of the exposure? Okay, that is it. So same thing, one is no association, less than one is reduced risk, and more than one is increased risk of that disease to be developed. Then coming to retrospective cohort, so I told you, right, prospective then retrospective cohort. So see, all the data is already present, okay, of the exposed, and we check down whether they developed a disease or not. Okay, what do we do is we'll go to the how this retrospective cohort is done is, so here we are not following them up. Okay, so as we did in prospective, so here the data is already present, meaning we'll go to our medical records department in a hospital. Okay, so we'll ask them, can you give them we'll ask them the manager over there, so please give me the list of all the people that came, the patients that came with the exposure of smoking. Okay, so let us take this as the exposure. Okay, so give me a list of all the people who had a history of smoking. Okay, then what I do is, so I check whether these people had developed lung cancer. Okay, so had developed, this data is also present. Okay, I am just cross matching whether these people developed lung cancer or there was no lung cancer. So this is retrospective. Okay, so all the data is present. Okay, so meaning what I was trying to tell is, so in both retrospective and prospective study, basically it is gonna be a cohort. In the cohort study, it is gonna be the exposure, and then we are going for the disease. Whereas in case control study, it was disease that they gave, and then we went on to check for exposure. Okay, that's it. Okay, this is the doubt that I wanted you guys to clear off. Okay, then here also relative risk ratio is also same, just like a cohort study. Okay, then there are two types of risk, that is attributable risk and population attributable risk. Okay, so these are the two types of risk that might happen in cohort study. Then these are I told you, right, these are the experimental studies we studied. Okay, so these are the observational studies that we studied. Now we'll go on for experimental studies. Okay, so here in experimental studies, randomization, okay, is what we first do. Then let me tell you the step, and then I'll tell you what it is. Okay, randomization, then intervention, follow up, and compare. Okay, so in experiments we are not observing something. Okay, we are trying to we are doing some intervention, and then we are trying to do the analysis. Okay, so that is what experimental means, right? So what we first do is we'll select randomly all the people. Okay, so we'll randomize them. Then what we'll do some intervention, probably give a drug. Okay, so vitamin E, let us take vitamin E or vitamin C that I'm giving. Okay, so then we'll check or follow up those patients whether they develop. So suppose I'm checking whether vitamin E causes reduced dengue or reduced see, vitamin E is now involved with reduced dengue problems, right? Complications will be reduced with respect to dengue infection. So that is what I'm trying to experiment. So this is how I do. So I'll follow them up, or I'll follow the patients. Okay, then what I do is, at last I'll analyze. Okay, analyze the complete data, whoever developed the disease, or whoever whether vitamin E worked in reducing the complication and all. So this is how I do the experiment, right? So these are experimental studies. Okay, so there might be biases when I choose these people. During randomization, I'll be choosing so certain male, certain female. I'll be choosing some 10-year-olds, whereas 50-year-olds it is different. So there is some bias that will be happening, right? So to remove that bias, I'll be doing blinding. Okay, so there is something called blinding. There are three types of blinding. One is single blinding, double blinding, and triple blinding. Okay, in single blinding, here the individual, the person who is being experimented won't know whether I'm giving up vitamin E tablet or a placebo, okay, some random tablet I'm giving, okay. So the person who is being experimented wouldn't know. Here in double blinding, here both the giver and the receiver won't know who I am giving placebo and who I am giving the vitamin E, okay. This is double blinding. Here in triple blinding, even the analyzer wouldn't know who has given like the giver has given the placebo to this particular patient or not. So this is triple blinding, okay, in that way. So to remove the bias, this is what we are doing. Then the other types of bias that will be there is lead time bias, Parkinsonian bias, Hawthorne and Pignolian bias, okay. So what are these? Lead time bias is screening tests, right? Screening tests, what so for example there is a experiment that I'm doing with respect to a screening test, okay. So what happens is this test will lead to diagnosis bias. Why? Because sometimes the screening tests wouldn't tell whether a particular disease is there or not, right? So that is why, for example, Monto test for TB wouldn't tell would have a difference between diagnosis and the screening, right? So that is the bias that will happen with respect to screening tests. Then Parkinsonian bias is selection of the case or control. I told you, right, just now when I was explaining with regards to bias removal, I told you, right, selection of the cases and control. So in hospital it might happen, okay. So this is called Parkinsonian bias. Then coming to Hawthorne bias, it is the change in behavior of the observer. For example, now I am doing the experiment. Suddenly, with regards to smoking or something, whether the smoker develops a, so he suddenly stops like smoking, okay. So now I am studying the exposure, right? So suddenly he stops smoking. So that is the bias that will happen, right? So experiment is completely false now. So that is called Hawthorne bias. Now coming to Pignolian bias, it is the observer bias. So some of the observer might be biased with certain people. He'll be judging the people, right? So that is called Pignolian bias. These are the types of biases that might happen with respect to experiment. And to remove this bias itself, I told you, right? So single blinding, double blinding and triple blinding is what we do. Then that is the main thing with respect to all the epidemiological studies, okay. So this is what you generally need, okay. Now I'll come back to the national programs. We'll go to the other thing, that is infections, okay. So in infections, please remember these two values. The droplets might carry till from 30 to 60 meters, whereas the droplet nuclei can carry the particular microbe for 100 meter, okay. So droplet is 30 to 60 meter, whereas droplet nuclei can carry them up to 100 meters, okay. In cases, there are primary case, index case, secondary case and carrier cases, okay. So primary case is the first case, okay. So for example, COVID happened in China, right? So the first case that happened was the primary case, okay. Then the index case is the first case that came to the attention. Like we still don't know who that person, exact person that first contacted that disease, but we know which was the first person that came into the hospital. So that was the index case, okay. That is the thing. Then coming to secondary case, from primary case whoever developed first was secondary case. Then the carriers are two types, that is incubators and healthy carriers, okay. Incubator carriers or they'll be not having the disease, but they'll carry everywhere, okay. But healthy will not have the disease, no disease, but whereas the incubator will be having the disease and will be spreading everyone, okay. So that is the incubator carrier, okay. These are the types of cases that I want you guys to learn. Then coming to the certain terms with regards to infections are, there is incubation, generational time, serial interval, isolation and quarantine. So I need you guys to remember the difference between this. These are the direct questions, previous year questions, okay. So the thing is, incubation means infection to symptoms, okay. From infection to first symptom is known as incubation period, whereas generation time is infection to maximum infectivity. Okay, so please know the difference between incubation period and generation time. Generation is maximum infection. Okay, then the serial time is the time between the primary case and secondary case. Okay, secondary case and primary case we saw it here, right? So it is the same thing, the time between these two, from the primary to secondary. Okay, this is known as serial interval. Then isolation and quarantine are two different things. Isolation is what we do for the deceased person. Okay, remember in diphtheria and measles we do the isolation, right? So that is who we do it for. We do it for the deceased person. Now with regards to quarantine, it is gonna be done to healthy but who is exposed. Here in diphtheria also we did the same thing, right? We were quarantining the exposed people, so that is what we did. So that is the quarantine. In COVID also we all were not exposed, but still we were all quarantined. Okay, so that is how this happened. The deceased person was taken to the hospital, whereas all the people who were in his home were quarantined, right? The notice board were pasted in front of the home. These people are quarantined for 14 days or something like that. So this is quarantine. Okay, so these people are kept until normal incubation period of that particular disease has been passed. For example, let us take measles. It is going to be 10 to 14 days, right? For 10 to 14 days, if they are we'll quarantine them and see whether they will develop the disease or not. If they develop the disease, they'll be taken to the hospital in that way. Okay, so these are certain terms I want you guys to know. Then levels of prevention with respect to infection or non-infectious disorders. So prevention is better than cure, right? So there are levels of prevention where we can prevent the death or further happening of the disease. Okay, complications of the disease. So let us see what are the levels. Primordial level is before the risk factors. For example, so smoking is the risk factor. Okay, so if we do not smoke at all, then this is called primordial prevention. Then primary prevention is where the person is already smoking. Okay, now what we do is we try to stop the smoking or prevent the disease from occurring. Okay, so we'll stop the smoking increases the arterial occlusion, which we studied in general surgery, right? So the thing is, we'll stop the risk factor from complicating it to a disease. We'll tell the person to stop smoking in that way. Then secondary thing is early diagnosing. Now the person has already developed the disease. Now what we'll do is early diagnosis and treatment of the disease so that the complication wouldn't happen. So tertiary is that's what. Then next was disability and complication is developing. Then for quaternary prevention is rehabilitation. Now the person has already developed a complication. For example, complication is we were now speaking with respect to smoking. We told first of all we didn't smoke, that was primordial. Now we were smoking and we told them to reduce smoking. Then smoking already developed arterial occlusion. So atherosclerotic plaque and all was developed. So he developed claudication. So we tried to treat the claudication, but it complicated into gangrene. Okay, so the gangrene was there, and we tried to prevent the disability. That is, we did do the amputation, but it complicated and we had to do the amputation. But now for quaternary will be after the amputation, we try to rehabilitate them by giving some prosthetic walkers and all. So we try to rehabilitate them. So this is the levels of prevention that I want you guys to know. So now with respect to infections, there is something called screening, sensitivity, specificity, then positive predictive value and negative predictive value. Okay, so you know that, right? We do screening tests for all the diseases. Okay, so many of the diseases we do screening test. Okay, so for example, screening test with respect to TB is Monto test and all we do, right? And when it comes to typhoid, we do Vidal test. So in these card tests, so we'll have to see whether it is sensitive, higher the sensitivity is there, whether is it able to detect the disease at an early stage, and specificity, meaning the diagnosis is proper. Okay, so will the was the person specifically having that particular disease, is what we are trying to prove. Okay, this is specificity. Then sensitivity, I told you, right? So that is how. Then how do we calculate it is, so above is disease and on the lateral side is positive or negativity. Okay, if it is positive and the disease was developed, true positive. If it was positive and there was no disease, then it is false positive, right? Then coming to negative, the negative test, if it is disease is there but still the card test told there is no disease, then it is going to be false negative. Whereas there was no disease and the test also showed no negative, then it is going to be true negative. Okay, this is how you arrange the table. So above is going to be disease, whereas on the lateral side please put up the positive or negative. This is where we ruin our calculation. This and all will be knowing, but this is how, oh, whether should I put a positive and negative above or on the lateral side is where we go, where the confusions happen. So now coming to the specifics of calculation. So sensitivity is true positive by true positive plus Fn, and then the sensitivity is true negative by Tn plus Fp. Okay, so how do we do that? So sensitivity, please remember, sensitivity and specificity, yes, right? So remember this here. So this is how we are calculating. Okay, so here also it is going to be here. So vertical is sensitivity and specificity, whereas positive predictive value and negative predictive value, please calculate it this way. So positive is TP, always TP comes up positive, and sensitivity TP, whereas in specificity it is going to be TN. Here also it is TN. Okay, so that is how you can calculate. Okay, so sensitivity specificity would be vertical. Okay, so vertical will be sensitivity and specificity, whereas the positive predictive value, negative predictive value will be horizontal. Okay, so this is how you can easily calculate the and put the direct values and calculate the screening questions. Okay, so then coming down to demographic cycle. Okay, so this graph, please remember, please go and take a look at the graph one more time. So it is going to be high stationary, early expanding, late expanding, low stationary, and declining. Okay, so India is in both this in early expanding and late expanding. If they ask the question, please mark it as late expanding. Okay, it is actually both of this, early expanding and late expanding stage is what India is in, but when they ask in question, please mark it late expanding stage, because India and China both are in late expanding. Now all our books you tell it is gonna be, because China has already already started reaching low stationary. Okay, so that is why India has come up to late expanding. Okay, then low stationary is Japan. Okay, so Japan is the best example. Okay, then coming to indexes of the society, it is gonna be HDI and PQLI, Human Development Index, and the Quality of Life Index, Poverty Life Index. Okay, so here the easiest way to remember this is schooling is there. Here also schooling, that is literacy. Okay, here in HDI it is going to be per capita income. Here in PQLI there is nothing. Okay, please remember that. Then coming to life expectancy, it is at birth in HDI, whereas it is life expectancy at 1 year. Okay, so with respect to PQLI. Then coming to one extra point with respect to PQLI is infant mortality, because here see both of them has 3 only, but here there is nothing with respect to income, right? So that is where the extra point of infant mortality rate is in PQLI. Okay, so remember that thing. So lowest poverty index is in Bihar. Okay, so Bihar is one example that I want you guys to remember. Where else did we learn about Bihar? Bihar was in leishmaniasis. Okay, whenever Bihar comes in, please remember leishmaniasis is one thing, another one is poverty index. Okay, then coming to environmental studies, the two values that I want you guys to remember is 0 to 50 is good, whereas 400 to 500 is severe. Okay, Delhi NCR has already reached Delhi has reached severe status. Okay, so Delhi has reached severe status. So now good was 0 to 50. Okay, then coming to water quality, so the characteristics of water quality can be seen by color, temperature, taste, odor, and turbidity. This is what determines the quality of water. Okay, then other one thing is Harrock's apparatus. Okay, Harrock's apparatus is what is done is 2 gram of bleaching powder. The entire calculation and all is there. They have never asked this calculation, but please, if you want to learn, go learn it from some book. Or some other YouTube video. Harrock's apparatus, how does it work and all. So they have never asked any question. Probably in some question banks and all they have given, but in previous year topics in any of the exam they have not given this Harrock's apparatus thing. Okay, so it tells about the chlorine demand of the water. Okay, so how the quality of that water is there. So based on chlorine is what we do it, right? So the interpretation is that 0.7 of the value that comes with Harrock's apparatus, 0.7 is drinkable. The chlorine level basically 0.7 is drinkable, whereas 2 is safe in natural disaster. For example, a natural disaster, a flood has happened, so we have to tell the people while rescuing whether it is drinkable water or not drinkable water, right? So that is when we do this chlorine testing, and if it is up to 2, it is safe to drink. Okay, in with respect to natural disaster, not normally. Okay, then coming to hard water, these are the components that will be there in hard water, that is calcium, magnesium, and iron. Okay, so please remember this, ferrous. Then coming to the disaster cycle, they have been asking hundreds of times this cycle, that is to arrange this cycle. Okay, so first thing is, one disaster happens, for example one tsunami or earthquake is happening. Okay, so after disaster, what we'll do, we'll all respond, right? So response is there. Then what we'll do the recovery or rehabilitation. We'll build all the houses and all. We'll try to rehabilitate. We'll get the JCBs, all we will try to clear all the rubbles that was formed because of the earthquake. So this is the rehabilitation phase or the recovery phase. Then what we'll do, we'll start rebuilding and redeveloping, right? So we'll do the redeveloping. Then after redeveloping, what we'll try to do, we'll try to mitigate meaning we'll analyze the situation. Okay, so this is an earthquake prone area, so what we'll do, we'll have to do anti-earthquake buildings and all. We'll have to do some walls. If tsunami prone area is there, we'll have to start building stone rich beaches and all. So that is what mitigation comes in. Then the preparedness. Okay, preparedness is for example, coastal guards would send the siren signals to the coast guards. Okay, so that is when we start preparing. Okay, so there is a or the meteorological department will send sirens and all. So we'll try to prepare ourselves. So we'll go under our tables if there is a earthquake and all, right? So that is what the preparedness is there. Then the disaster will happen. This is how the cycle goes on. So disaster, then the response will be there, recovery will be there, then we'll start to redevelop the thing, then it will go for mitigation, then the preparedness. Okay, so this is how the cycle is. Okay, please remember this cycle. Then with respect to, this is all we are speaking with in respect to environmental studies. Okay, so biomedical waste management, very important. Hundreds of times they have asked. So red, remember R for R, red is recyclable. Everything, all rubber, all this plastic, everything is recyclable, right? So please remember, wherever recyclable stuff is there, please go for red. Okay, even gloves, all these things is red. Okay, so remember that. This is a controversial thing. Where should the blood bag go? Okay, blood bag, that is also plastic, right? Plastic or a rubber thing. Okay, where should the red where should it go? Some of the books and even in internet they have given it as red, but in our exams and all, in the answer case they are giving yellow. Okay, so don't know why, because probably they think that it is communicable and it is infective. That is why they are putting it in yellow. So but remember, elsewhere they are giving it red, in red, plus but please, we are gonna put the blood bag in yellow. Okay, so please remember, yellow is human waste, cytotoxic drugs, and lab wastes, all these things, and including the blood bag. Okay, only exception with respect to recyclable thing. Okay, see, blood bag is also recyclable, but they are putting it in yellow, so that is the only confusion that we have. Then with respect to blue, we are gonna put glass and metals. Okay, so all the broken vials and all we used to put in a blue bin, right? In hospitals we used to put in blue. Okay, so remember in that. Then white, remember in all the hospitals in our internship also we used to put all our needles and all into a small white box, whether it is a government hospital or a private hospital, it is the same thing, right? A small box, white box will be there, and there we used to put all the sharp blades and needles will go to white. Okay, so this is with respect to biomedical waste management. Okay, then the other thing for the environmental study is all the thermometers and instruments of measurement. Okay, the first thing is kata thermometer, which will tell the air cooling effect. For example, a AC is there and we are trying to test the cooling effect of it, we'll use kata thermometer. Globe thermometer, please go and see all the images of this. Okay, kata thermometer, globe, all these meters, please go and see an image. Okay, image based question is what they are asking. Okay, then globe thermometer will do the radiant heat difference between two places, like we are inside a room and outside the room. Okay, so whether the ventilation is there or not, so that is how the globe thermometer, here is where it comes in. Okay, then coming to anemometer, the velocity of the air, velocity at what wind speed is the air traveling is what we anemometer is what we use. Then coming to hygrometer, it is going to be air humidity is what we are testing. Okay, so what is the humidity value? For example, we are in a beach city, for example Kerala, Mangalore, if it is, then Pondicherry. So what is the humidity difference between these places that we see, right? This is where we use hygrometer. Okay, there is also something called psychrometer, where we check for relative humidity. Okay, there are two bulbs here. Okay, so there is something called psychrometer, where same thing, air humidity only we are checking, but relative humidity we are checking. Okay, so there are two bulbs here. Okay, so please go see the images of these two things, this is very important. Then the barometer is for air pressure. Okay, so this one more time I want you guys to learn before going into the exams. So this is all and everything that you need to know with respect to the environmental studies of PSM. Then we'll go into some of the miscellaneous topics before going to exams. Let us know this. Okay, so there are barriers. Okay, so PSM is all about going into the villages and all the other communities and all. So that is where we start giving them lectures, right? We used to go in our internship, right? So this is where the barriers might come in. So there are different barriers, that is cultural barriers, where our belief and their belief or the customs might be different between the village, where there are cases where they have beaten certain people who are from the PSM department, and they'll send off from the village only, they'll send off. Okay, because their values are different and our values. This is where the cultural barrier comes in. Psychological is physical disability. Okay, meaning they wouldn't be able to come to our lecture or something like that. Okay, physical disability will be there, or we wouldn't be having some mics, all these things, the materialistic thing will be there. So this disability is known as physiological barrier. Then psychological is emotional or mental differences. Okay, so this is quite different from cultural barrier. Emotionally and mentally it is a different thing. Okay, so please be aware of these two differences. Then semantic is language barrier. Okay, suppose I will be speaking Tamil, but he's an Hindi guy, so we wouldn't be able to connect, right? So this is semantic barrier. These are the types of barrier. Then coming to biostatistics, so it is very easy. Actually, it is a direct question that they are giving. Okay, so we should know how how to identify that question. Okay, that's it, what we are supposed to do with respect to biostatistics, and definitely you can score this. Okay, so there is a measure of dispersion. Okay, so first thing is there is a measure of dispersion or the central tendency, you know that, right? Since 10th standard we are doing this mean, median and mode. Probably even since 5th standard we are doing mean, median and mode. Okay, mean, median and mode meaning, so mean is the average value. For example, certain values are given and we are trying to average, meaning what we'll do is all the values will add up and divide by the number of values. Okay, so that is how we'll get the mean. Then the median is the middlemost value. Okay, so middlemost. Okay, 4 5 6 is there here. The median is 5. Okay, so in that way, mode is here only. See, okay, wait, 4 4 5 6 7 is there. The repeated value is 4, right? So that is mode. Okay, that's it. Okay, with respect to central tendency or median of dispersion, the central tendency is on all there. So this they'll ask you some easiest questions only. Okay, then coming to sampling and distribution, this is also a type of biostatistic study. Then coming to tests of significance, what they are interested in. Okay, so there are different kinds of tests of significance. That is unpaired t-test and paired t-test is what first I'll tell you. Okay, so if there is comparison between two independent groups in the question, it is going to be unpaired t-test. Okay, for example, 50 men and 50 women they have given in the question itself. When you see the question itself, you will be able to identify, and in the options they will be giving on unpaired, paired, ANOVA, chi-square, all these 4 options will be there. Okay, so if it is two independent groups, see, there is no connection between men and women, right? So there are two different independent groups, okay, in the question. So that is when you go for unpaired. Okay, so there is no pairing only. When it comes to paired, it is comparing before and after in a same group. Okay, so for example, there is 50 men only they have given. If it is 50 men, what we are comparing is before and after developing hypertension, what happened. Okay, or for example, before antihypertensive or after hypertensive in this 50 men only, there is no 50 women. Okay, so this is paired t-test. Okay, so there is no comparison between two different groups. Okay, that is where paired t-test, just by seeing a question itself you will be able to identify. Then coming to ANOVA, it is where comparing 3 groups. Okay, unpaired was 2 groups, paired was no groups, paired was no group, unpaired was 2 groups, ANOVA is 3 groups, 3 different groups they will be giving. Okay, then coming to chi-square, it is the quality, they'll give some quality. For example, a smoker and development of lung cancer. In these things, these are the questions that will be there. Smoking or some qualitative values they'll be giving. For example, HP percentage they'll give. So it will be there in the question itself. That is where you should go and choose for chi-square. You would be definitely knowing what type of these things just by knowing what I've just told you. Okay, then there are different types of graphs. Okay, pie chart, bar chart, histogram. Okay, so please go through and see the image based identification of these graphs. Okay, then coming to surveillance, there is passive surveillance, active surveillance and sentinel surveillance. Okay, so surveillance, if the patient comes to the hospital. Okay, so for example, I am doing a COVID survey. Okay, so surveillance I am doing. Okay, so patients have come to the hospital and now I am doing the survey. So what happens is, I have the data already, right? So now the patient has come and I'm doing screening test, diagnostic test, and I already have the value and I'm gonna upload myself to the data, right? So this is where passive, you need not do anything. Whereas active surveillance is where I'll send some of my volunteers, that is ASHA, ANM, to go to certain house and check whether that person has COVID. Okay, this is called active surveillance. Okay, then sentinel surveillance is where we have missed certain cases or there has been dead cases that are there. Okay, so this is where sentinel cases come in. But please remember, for example, a patient goes to the hospital and there he has died, it is going to come under passive, right? So in hospital he has died, meaning it comes under passive. Whereas he has already died and someone else tells that this person was dead because he had COVID. Because see, here ANMs also didn't check, and he also didn't come to hospital. So both passive and active was lost. So this is where we after his death we got the surveillance data, right? So this is the difference between passive, active, and sentinel surveillance. Okay, so now coming to the important the thing that I wanted you guys to tell was some of the national programs. Just before going into the exams, all and everything is based on image based. Okay, so they'll be definitely asking based on images only. So some of the other many different things are there. There are thousands and lakhs of programs that has been put up by all the NGOs, all the organizations, WHO, UNICEF, many things are there. Okay, we can't remember everything, right? So only the important ones that we shouldn't miss I'll be telling you, that is JSSK. This is not JSSK, this is Janani Suraksha Yojana. Okay, so in Janani Suraksha Yojana, they are giving 1000 rupees to the mother and 400 rupees to Asha. Okay, please remember this. Janani Suraksha Yojana, they are giving 1000 rupees to mother and 400 rupees to Asha. Okay, 1400 in total. Okay, then the newest thing, the census mascot. Okay, the census is going on all over our India. So now the two mascots they have released, that is Vikas and Pragati. Okay, please remember, for man it is a man is Vikas and Pragati. Okay, then coming to IVCF guidelines. So this child tells that after 6 months we will start the weaning, right? During weaning period, what should be the proper weaning that should be done? That is half katori of whatever the thing or the feed that we are starting, half katori for 3 times a day. Okay, so half katori for 3 times a day is what we do for more than 6 months of child. Okay, then the Indian census de facto. Okay, this is a previous year question. So Indian census de facto, what is in de facto method? So in India census, so each country follow a different method, but we follow de facto, meaning so location of the individual at the time of enumeration. For example, I am somewhere, I am not from Mumbai at all, so I am not from Bangalore, I am from somewhere in Tamil Nadu. But I've visited in Bangalore, and the some Indian census guy would have come. So or I've been staying in Bangalore. Okay, so I'll be counted as a person from Bangalore rather than my birthplace. Okay, so location of the individual at that time of enumeration is what Indian census takes place. Then this is known as de facto system. Okay, so these are some of the important national programs, and all the other things, please remember leprosy, UNICEF, and all these mascots for leprosy, there are, right. So and TB, and the voice box that we use for NTP and TB. So remember these things. Okay, with respect to the image based identification in the national programs. Okay, then you'll be done with all the topics with respect to PSM. Okay, the major one more left out topic is contraceptive. Okay, so we'll discuss about contraceptives. Okay, it is very, very important because there are different questions that can be solved just by this one single paper. Okay, you'll be able to solve different questions just by this single paper. Okay, let us see contraceptives. There are types. Okay, so oral contraceptives are there, which will be OCPs and progesterone. Oral contraceptives, the oral combined pills, and progesterone only pills will be there. Then there is something called Chaya. We'll come back to that. Then the other types are long. The other classification that we can do is long acting, emergency, and permanent. Okay, so this is how contraceptive goes on. Okay, then coming to long acting, so it is DMPA or Antara. Okay, so you should be able to identify the image based question they'll ask you. Okay, so DMPA Antara is an implant. Okay, so please remember this. Then there are this is not an implant, this is a drug. Okay, so DMPA. Then there are IUCDs. Then there are implants. Okay, so these are long acting type of contraceptives. Then coming to emergency contraceptives, please remember plan B, LNG. Okay, levonorgestrel. Okay, then the other main thing is ulipristal. Okay, I'll come to all the mechanism of actions. Please bear with me. Okay, so these are the classification that I wanted to give you. So there is oral contraceptives, in oral contraceptives there is combined pills and progesterone only pills, and one more thing is there, that is chaya. Okay, this is nothing but orniloxifene. Okay, please remember orniloxifene. Okay, what it does is it prevents implantation. Okay, it is given 2 times per week. Okay, so 2 times per week is what we give for 3 months, and then we'll turn for 1 week, 1 time a week. Okay, so for 3 months, starting 3 months, we'll be giving 2 times per week. Okay, then coming to we'll start with one by one. We'll start studying about OCPs. Okay, OCP, I told you, right? Oral combined contraceptive pill will be estrogen plus progesterone. What it contains is, one sheet contains 30 pills. Okay, so in that 21 of them will be hormonal. These hormones, that is estrogen, progesterone will be there. Then the rest 7 will be ferrous fumarate. Okay, this is to address the bleeding that goes on with respect to OCP. Okay, so this is where the 30 tablets come in. Okay, so how do you consume? So how do you tell a patient to consume is, ideally we'll tell them to start on day 1 to 5 and 1 pill a day. Okay, 30 days, 30 pills. Okay, 1 pill a day will do. So the examples are Mala N, Mala D. So these are free tablets that they give, right? Then progesterone only pill, I told you, right? So the example is norethindrone. Okay, so remember that name. Norethindrone is a progesterone only pill. Then coming to some of the notes I want to give you is, a return of fertility will be rapid, or it will be within within 3 months. For example, the patient comes to you and tells you, I've been taking OCPs and now I wanna resume, or I wanna consume, and I don't know whether I'll be able to consume or not. Your answer should be, it would be rapid. You need not do anything, no intervention is needed. It might happen rapidly, you can start consuming, or it might take 3 months. Okay, so this is what your answer should be. Okay, when will the return of fertility? Then the major and most important thing with respect to the contraceptives is the missed pill guidelines. But before that, let me tell you what are the mechanism of action of these drugs. Okay, we'll come back to mechanism of action. Let me finish off the missed pill guidelines here itself. Okay, so this is with respect to OCPs that we were talking, right? So OCPs is what we are gonna miss. Okay, so because the other things, the implants or the other permanent stuff, we need not remember. Okay, but here OCPs is what we are supposed to miss, right? So that is why what happens is, missed pill guidelines has been given. Okay, so from the government of India, the missed pill guidelines has been given, where if the patient misses less than 3 pills, so what we do is, 1 pill immediately is given, then there is no backup required. Okay, so if it is less than 3 pills, then it is going to be 1 pill immediate, and then there is no backup method required. Suppose if it is more than or equal to 3 pills, it is going to be two things. Okay, two things should be aware, whether we have to ask whether it was first or second week that she missed it in, or it is the third week of tablets that she missed it in. Okay, so if it is going to be first or second week that she missed it, it is going to be 1 pill, same like the less than 3 pill, where 1 pill will be giving immediately, then continue the pack normally. Okay, then additional backup method of anti-contraceptive is required. And one more thing, the important thing is, if in less than 72 hours, if there was an intercourse that happened, then emergency contraceptive is required. Okay, so please remember this with respect to less than 3 pills, more than 3 pills. Okay, then coming to, if it was in the third week that she missed the pills, it is going to be same 1 pill immediately. Then the main thing is, please discard the ferrous fumarate, the 7 pills I told you, right? In the 30 pills there are 7 ferrous fumarate pills. So please discard that and tell that to start a new pack. And then same like the first and second week, we are going to go for additional backup method, and if there was a intercourse, then it was 72 hours of emergency contraceptive. If it was less than 72 hours, we'll go for emergency contraceptive. So this is with the guidelines with respect to missed pills. Okay, then some of the important points with respect to OCPs are, there is increased risk of breast cancer and cervical cancer. Okay, please remember, there is increased risk of breast and cervical cancer. There is reduced risk of endometrial carcinoma and ovarian carcinoma, colon cancers and benign breast cancers. Okay, there is reduced risk if the OCPs are being used, okay, with respect to these things. Okay, then the adverse effects are, you all know, right? It acts like a coagulant. Okay, so that is why DVT, MI patient, stroke patient, please be aware before giving. There is increased adverse effect, so that is why it is contraindicated in these patients, DVT, MI and stroke patients. Then we'll start with now that we are done with oral contraceptives, we'll go to some of the other contraceptives, that is implants. Okay, so starting implant is IUCD. Okay, intrauterine copper device. That is, please remember the points, you know all the things, right? The other copper T and all the names and all you would be knowing. Okay, so contraindications are in pelvic inflammatory disease, AUBs and uterine abnormalities, it is contraindicated. Okay, if a pregnant with IUCD comes, okay, so if a pregnant with IUCD comes, these are the questions they have been asking. Okay, so these are the case scenarios that they'll ask. If the IUCD have placed, but suddenly the patient has consumed. Okay, there are cases of failure of IUCDs, right? So this is how the patient has suddenly consumed. Okay, so what do? We'll ask the patient if the patient is desirable or not desirable. Okay, if the patient is not desirable, what we do is we'll do MTP. Okay, based on whichever the date she has come in, so we'll do MTP, medical termination, then we'll remove the IUCD. Okay, because that is a failed IUCD, right? So that is why we'll remove that IUCD. Now if the patient desires that she wants to continue, if the thread is visible, we'll remove the IUCD, because it is a failed IUCD, right? There is no use of it. So if thread is visible, we'll remove it off. But if thread is not visible, then we'll leave it alone and continue the pregnancy. There is no issue with continuing the pregnancy. Okay, this is how we manage, okay, in cases of IUCD. Then coming to the other implants, that is long acting. Okay, so with respect to long acting, DMPA injection, okay, or Antara, I told you, right, it is a drug. Okay, please go and see the image based question for this. So Antara you should be able to identify just by seeing the packet of it. Okay, so it is a DMPA injection which is 150 mg every 3 months we are supposed to give. Okay, every 3 months we are supposed to give. It is a IM, okay, intramuscular. Every 3 months we will be giving. It is a long acting thing. Okay, so suppose if it is missed, if the three, if we are suppose it has been missed for a month, so let us see what happens. If it is less than 4 weeks and she has missed the next dose, so start a new one. Okay, no need to worry. Okay, start a new one. If it is more than 5 weeks, okay, there might be pregnancy, right? So that is why we are gonna rule out UPT. We are gonna rule out UPT and then we'll give a backup and then start a new drug therapy. Okay, so we'll start new DMPA injection. Okay, so this is how we'll manage if it is missed. Oral contraceptive missed and long acting DMPA injection missed is very, very important. Okay, then coming to implants, there are many kinds of implants. The two important ones are Implanon and Norplant. Okay, because the efficacy of these two is different. Okay, Implanon is a single rod, whereas Norplant is a 6 rods. Okay, in single rod 3 years of efficacy is there, whereas in Norplant it is gonna be 5 years of efficacy. Okay, so these are the implant methods. Okay, we discussed about oral contraceptives, we discussed about the long acting contraceptives, and we discussed about implants, and now we'll go for emergency contraceptives. Okay, so emergency meaning, so as probably there was a failed contraceptive method, or there was no protection used in that way, so emergency consumption would have happened, and they are suspecting pregnancy. That is when we'll give emergency contraceptive. Okay, so we all know, right, I pill and plan B. Okay, we all would have seen this in our spotters, right? I pill, plan B. Okay, plan B elsewhere in the world. In India it is traded under the name of IPL. Okay, so what does it contain? LNG, that is levonorgestrel. Okay, 1.5 mg single dose is what we give. Okay, 1.5 mg single dose is what it contains, and it is best used in less than 72 hours. If it is less than 72 hours, the patient has come up and tells you that they have a fear of consumption, this is what you do. Okay, IPL or plan B. For example, the period has reached more than 72 hours, it is going to be ulipristal acetate is what we use. Okay, ulipristal acetate, it is a 30 mg single dose. Okay, so 30 mg single dose is what we use as a emergency contraceptive. Okay, this is all and everything you need to know with regards to preventive and social medicine. There are different 100 different other things with respect to PSM that that you can know just by solving the questions. Okay, so this is how you can clear off a PSM. Okay, now the main thing I want you guys to tell is that we have covered all the general topics. All the general topics are done. Now will be moving on to the specifics of head, neck and face. In head, neck and face, we'll be covering all the neurology, endocrinology, ENT, ophthalmology. Then ophthalmology will be covering ears, nose, throat, everything will be covering in head, neck and face. All the pathology, physiology, everything will be done. Just bear for few hours and you will be done for entire MBBS. Okay, then coming to thorax, we'll be going for cardiology and pulmonology. Here the heart and the lungs both will be done. Then coming to abdomen, you'll be done with the gastroenterology, GI tract, everything will be done. Then hepatology. Okay, liver. Okay, liver, pancreas and gallbladder. Here hepatology, everything will be done in abdomen. Then coming to pelvis, the two main topics, that is nephrology, kidney, right? Kidney is what will be done. And then the major topic, the uterus, that is obstetrics and gynecology. Okay, then you will be done. Okay, so general topics, all the general topics we have finished. Now we'll go for all this systemic topics. Okay, that's it. Thank you.